Guests on the show today are from the Center for Family Health. We have certified nurse midwives, Missy Ferlet-Koski and Gretchen Hackenjos. Welcome to the show.
Thank you so much. Happy to be here.
Great to have you here.
Yeah.
The last time you were here, you were promising you were going to have some more midwives.
Yes, and now I do.
Now you do.
Yes, Gretchen joined us about a month ago.
Awesome. Well, welcome to the midwifery department. Is that what it's called?
Midwifery.
Midwifery.
You were close.
Midwifery.
Yeah, midwifery.
Midwifery, and it's an ancient science. Ancient.
It is. It's an art and a science.
Art.
Yes.
Yes. We probably should explain for people like me what midwifery is.
Yeah. So, midwifery is the oldest profession. So midwives are the original community health workers.
It's the oldest profession.
It's the oldest profession.
Okay, that's contrary to what?
Yes, but originally midwives were community health workers who would travel to people's homes and deliver their babies and take care of them prenatally and handle a lot of emergencies that would happen in more rural settings. And then it evolved into somewhat now of a nurse practitioner kind of role where I'm a nurse midwife, so I have I'm a registered nurse, and then I have a master's of science in nursing, and I passed a board exam and am a specialist essentially in maternal and fetal health. So I can take care of people prenatally, I deliver babies, I take care of people postpartum, I also prescribe birth control, do menopausal care, and annual exams.
Wow.
Yeah.
So it sounds like better than a doctor. If you're a mom-to-be, you'd want all that expertise and experience and training, I would think.
Absolutely.
Yeah.
Yeah.
So you're, Gretchen, a certified nurse midwife. Is that different from what Missy's is?
No, we're both doing the same thing,
thing.
certified nurse midwife. So I was also a registered nurse and then went to midwifery school, took a board exam, and now I'm a certified nurse midwife as well.
And we see, like, nationwide, the healthcare climate is changing where small community hospitals and healthcare providers, they're disappearing.
Yeah.
It would seem like your services would be more in demand in general because of that.
Mm-hmm. Well, and a lot of people want low intervention care or more holistic care, and part of what midwives do is that they meet patients where they are. They look at you as a whole person. So I might say to someone like, how are you today? And then you usually get like, I'm fine, how are you? And it's like, oh, okay, so what are you doing to fill your cup today? What's bothering you? What can we do to help you? What kind of support do you have at home? It's not just, is your baby moving? Let's listen to your baby. We'll see you in a couple weeks.
And people aren't used to getting that kind of attention when they go to see the doctor.
Not necessarily, no.
Yeah, they've got the chart and they might not even, because of the workload, you might not even get eye contact.
Mm-hmm. Right.
So it sounds like, the personal touch is a very big part of the science and the art of midwifery.
Yes, definitely.
And it's been in demand. So you, as an organization, the Center for Family Health, you responded to the women in the community saying, we want this service.
Yes. And now we're here, and we're not only providing care at the center, but I have privileges at Henry Ford Jackson now, and I've been catching babies, so it's going really well.
See, I would have said catching babies, but that's what you call it.
Yeah.
Professionally, we're catching babies.
Yep.
I'm running up to the hospital. I've got a couple babies to catch.
Yep, exactly.
That's your slang.
Correct.
Awesome.
Yeah.
And it's instead of, typically giving birth, the doctor is attending.
Mm-hmm.
And that has been the tradition for so many births. But you don't need a doctor, and a doctor doesn't need to be anywhere on the premises.
We have, so when we're on call, we do have a doctor who's a backup. So if there's an emergency that happens, they can come in. If, for instance, we needed like a vacuum or forceps delivery, or if the labor is not progressing and we need a C-section, there is someone that's there.
Why did you decide, Gretchen, that you wanted to be a certified nurse midwife?
I think it all started when I was a child. I was always so fascinated in this TV show called A Birth Story. It's just, birth is just so raw and natural, and I think just being able to respect the natural physiological birth process and just being with the woman, which is what midwifery stands for. So just being at their bedside, tailoring your care towards the woman, personalizing your care towards women and what they're expecting out of their birth stories.
So explain how the word midwife, what that does come from.
I honestly don't know all the history where the word comes from. I just know the term midwife is to be with women, is where that word comes from.
We think about women that want to have more of a natural birthing experience where no drugs, no equipment, no bright lights that maybe do in the bathtub at home, things like that. Are people asking for those kinds of things from a midwife?
I mean, I've had a few where they're like, so can we do tub births? And I'm like, unfortunately at the hospital we can't do tub births, not saying that they can't be in the tub, because you can use it as a pain relief or a comfort measure or to be able to relax in the tub. But unfortunately there is no tub births right now.
Yeah, you can.
Go ahead.
Yeah, you can labor in the tub, you just can't deliver in the tub. But people can have, some people do, there has been a movement towards more low intervention births. So what that means is that people don't necessarily want to be on continuous monitoring. They don't necessarily want epidural for pain management. They want to be able to move in labor. They want to be able to change positions if they want to. They want to control the support people that are in there. And so essentially people want more say in what happens with them. And I think that what's interesting about the work that we do is that we can facilitate those kinds of births, and Henry Ford Jackson is a great hospital to do that, because we do have what's called intermittent monitoring, where you don't have to be hooked up all the time if you're normal and low risk. But if something happens, or if you need an induction, or if there's other needs that you or your baby have, we have neonatal nurse practitioners that are on staff all the time. We have an extensive pediatric team. So we have all the people that we need on hand, and doctors should something happen that needs a higher level of care. So it's sort of a best of both worlds. You could do not a whole lot, or you could do a lot, and either way the same house happens in the same place.
So is that new, being able to have hospital privileges?
It's new for me to have hospital privileges, but each time you move facilities, you have to get granted privileges and essentially prove that you're a responsible provider that is credentialed. Yeah.
So our goal as a community, and yours, is the outcomes, the great outcomes, healthy moms, healthy babies.
For sure.
Does having a midwifery program and access to certified nurse midwives provide more towards that whole idea of infant and maternal health?
Absolutely. The higher birth weight babies, so babies are born less small if they have a midwife. Their higher breastfeeding rates, higher birth satisfaction, all of those things play into the midwife stats that makes us.
That's great.
That's great, yeah.
Yeah, so you would probably have more, there would be more prenatal visits. There would be more contact with you before the baby is born.
Yeah, so we start from preconception, which means before they're even thinking about getting pregnant, explaining how to be healthy and how to get to obtaining a pregnancy, towards the prenatal visits up to when it's time for baby to be born, and then postpartum we see them again and check in and see how everything is doing.
Awesome.
So.
All right, available now at the Center for Family Health. And real quick, Missy, you've got a schedule on the drive-through and the pharmacy and the clinic.
Early fall, we should be transitioning to our drive-through pharmacy, which is really exciting. And then we will also have the walk-in back at the 505 Jackson building. So we don't have an exact date yet, but I know it'll be early fall.
Awesome.
Yeah.
Great to have you here. Thanks for
Thanks
coming
for having us.
Yeah.
Thank you.
Providing certified nurse midwifery services at the Center for Family Health, certified nurse midwives, Missy Frolette-Koski and Gretchen Hackenjost.